As we realized more and more dogs were getting sick, we started to first reach out locally to other community veterinarians to confirm they were seeing what we were seeing, and then working through our vaccine manufacturer to work with the university to try to put all this together.
In the Chicago situation, the samples were coming back with no answers. There were multiple tests were coming back with virtually nothing.
When we understood that this was not H3N8, that it was probably something else, we were really aggressively then trying to do the kinds of testing that we needed to do to identify what this was.
Especially when we're dealing with respiratory disease that is new or unknown in a community or in a shelter setting, doing diagnostic testing helps us differentiate amongst all of the potential pathogens when we're seeing those kind of nonspecific signs.
Merck was fantastic. They put us in touch with their veterinary division at Merck, who assisted us with submitting samples and trying to identify the true cause behind this outbreak.
Merck, because of some work we had done with them previously, knew we had developed this respiratory panel here and it was very effective in what we were doing. They, through their clients and their representatives of Chicago, started getting samples directed to us. So they were absolutely instrumental in us being involved in this particular outbreak.
So I worked with Cornell very, very closely. Their viral lab was incredibly helpful in just guiding us on how to obtain the proper swabs for testing and what they're looking for. And as they diagnosed and isolated the H3N2 strain, you know, what they were taking from South Korea and helping kind of filter that information to us.
You know, if it was just one veterinarian or two veterinarians randomly submitting tests, we wouldn't have figured it out, right? So by Merck even paying for all these tests, it was helpful because I think it helped get the ball going that we were able to identify, or you know, through Cornell and all these different diagnostics labs, they were able to team together to identify it was a totally different strain.